We have Al-Ekram Ilahi Ridoy from the University of Chittagong in Bangladesh here.
Yes.
He's the lead author of a paper titled Forecasting COVID-19 Dynamics and Endpoint in Bangladesh, a data-driven approach, posted on medRxiv in June 2020. He is a student at the university and currently working on additional analyses related to COVID-19 in Bangladesh. So Ridoy, I wanted to ask you a couple questions about your paper and some of your work and why this work is important in the context of this pandemic. So first, your recent paper estimates the effective reproductive number of COVID-19 or SARS-CoV-2 over time in Bangladesh and its districts using reported cases of COVID-19. Why is this important to estimate the reproductive number? And how does this RT, or the time varying reproductive number, inform outbreak control?
Okay, actually there are many metrics to measure the COVID-19. Among the various metrics, the transmissibility of an infectious disease, the basic reproduction number is more pronounced in scientific community, because the other metrics, let's say growth factor, that does not give a picture of real transmission scenarios. That's why it's most used metrics I have used in my papers. Okay. Because when an outbreak progresses, then the time variation reproduction number is called what is RT, meaning that the number of secondary cases generated from a single cases. So it gives a rough pictures, because we don't have any robust other metrics to track disease transmission.
All right. And so you found that the RT initially was 3 in Bangladesh, and it dropped to about 1.47 after a nationwide lockdown was imposed, and then down to about 1.06 at the end of the phase 1 of lockdown. And then it increased slightly during the end of, or towards the end of the lockdown phase 2. Were these results surprising to you? Did they tell you anything about what was happening in terms of control? And why are these so important to know in the context of these control measures?
Okay, the initial R was 3, but 1.07 was the day before the lockdown, not the mean. The mean I calculated was 2.20, which means one single infected person spreading the virus to 2.20 others. In lockdown phase, it was about 1.47 or something, slightly reduced. It was about 30% reductions from the initial phase. In the second phase, it was also 28% reductions. But it surprises me a lot. After the lockdown was lifted, the R was very low. This can be attributed to the low number of performed testing, I believe.
Okay. And do you think, so you think that based on these RTs, the lockdown was effective at reducing transmission in the country?
Yes, moderately, very slightly, I can say.
Okay. And what are some of the assumptions you had to make about reported cases, and like how comfortable are you with these assumptions? And do you think these findings that you have are sensitive to some of these assumptions?
Yes, it was very hard for me to fix the parameters, the serial interval time, the incubation period. There is no studies about serial interval time and incubation period in Bangladesh. So I have assumed very low serial interval times, about 4 days, and incubation period of 7 days. So since I have assumed serial interval time 4 days and incubation period of 7 days, this indicates there a significant proportion of secondary cases are generating, indicating that pre-symptomatic cases are occurring.
Why do you think, why is it challenging to do these estimates and do this work without the data from Bangladesh? Why does this matter to have those data from Bangladesh?
Because there is no data, public data of the line list of COVID-19 in Bangladesh. So it's very hard to estimate the serial interval time as well as incubation period of.
And you think that those might differ in Bangladesh than other places?
Of course, serial interval time can be 4 days, 5 days. Incubation period can fluctuate between 7 and 14 days. Since we do not know these numbers, we have to assume if you knew those numbers, it would be very accurate to estimate the RT or R.
So in your experience then, is this generally speaking a challenge for doing this kind of work around the world?
Of course.
Like do these problems with making assumptions really change some of the results that are produced?
Of course, of course.
So I guess then, given that, what can people do better, both in the field and from the standpoint of researchers doing this work? What can we do better to make sure we are appropriately assigning these parameters and these data and reporting what assumptions we're making?
The best they can do, if there is no study or data, I think taking several studies average mean. For example, one of my research paper, I have there is about 11 studies incubation period time. So I have took the mean number of this. It's about 5.5 days.
Okay. Yeah, so taking a kind of a distribution and not just a single estimate.
Yes, distributions. 4 days, 5 days, 7 days, it can vary much.
And so how do you think your results and the results of studies similar to yours have or can be used to inform public health policy, and help inform the public to maintain control measures and behaviors?
Yes, the importance of those results is significant because we do not have any other metrics to track the disease progressions. Thus, if R says the R value is greater than 1, that means epidemic is still persistent and is continuing exponentially. If R is less than 1, we have contained the virus. So I have seen about 100 days R was below 1. That means there is a slight less number of cases are appearing. But now I think Bangladesh on the cusp of second wave of COVID-19 because R also increased from October till now above 1.
Okay. And if that R keeps increasing, do you suspect that that wave will grow and we'll start to see a lot more cases in Bangladesh?
Yes, current R of Bangladesh is about 1.2 or 3, which is like the initial phase.
Mm-hmm. And what can Bangladesh, both from the government and from individual perspectives, what can they do to improve their behavior and control?
I think the best they can do is in place lockdown, stringent measures, maintaining social measures people.
Okay, great.